Today, our topic for our webinar is navigating community clinical linkages during COVID-19. And we have staff members from the Santee Health and Wellness Center presenting today. We have Michael Henry, the Wellness Center Director, Jennifer Cole, Director of Community Outreach, James Canning, Health Educator and Lifestyle Coach, Mark Rosen, or Coach Rosie, the founder and director of Coach Rosie Performance, and we have Christine Flyinghawk, culinary food and wellness instructor and farmers market manager. And this team today is going to each share examples on how they have reprioritized community clinical linkages to effectively approach chronic disease prevention in the midst of COVID-19 and their disrupted traditional work plans and workflows. So I will share their presentation here and I will let them begin. Okay. Can you see that okay?
Yep.
Yep.
I'll let you guys take it over then.
All right, you can go to the next slide. So thank you for having us. My name is Jenny Cole. We'll introduce our team here before we start our presentation. But my name is Jenny Cole, and I am the Director of Community Outreach here at the Santee Health Center, and then the co-director of this sub-award here with Great Plains. Just a little bit about me. I've been in RN for the last 18 years, worked in just a bunch of different healthcare settings, mostly in a hospital setting, and then been here in Santee on the outpatient side for the last almost 3 years now.
My name is Michael Henry. I'm the Santee Wellness Center Director, also a co-director of the sub-award as well. I'm going on I've been here for over 4 years now in my current position, so pass it over to Jay.
My name is Jay Canning. I've been here at the Wellness Center for 3 years as well. 2 years as the health educator, and then I was in the Wellness Center for a year before that. And prior to that, I was a high school English teacher here in Santee.
And Mark Rosen, I've been working with the Santee Wellness Center group for going on 3 years now. Started off doing some presentations, community work, then we started to work with some youth programs and just got more involved in the education, the health and wellness. I'm a strength and conditioning coach. Certified strength conditioning coach, been one for 30 years, which means I'm an old guy and got initials behind my name, which means I'm in a lot of debt. So that's what that goes from there.
I'm Christine Flyinghawk. I am our culinary food and wellness instructor for this grant. I teach full-time as a family and consumer science teacher at Santee Community High School and Middle School. And with that, I also teach culinary and food and wellness for our high school students. I have spent 1 year working with Santee Health Center as the health educator, and I operate our farmers market for the community and assist with our community gardens. Okay, you can go to the next slide. So just a little bit about our initial sub-award vision. With obesity being a significant health concern that adversely impacts overall health and cost of care, the Santee Health and Wellness Center's vision with this funding was to initially create and develop a sustainable quality improvement project that would evolve the state of obesity management and develop effective and innovative treatment and preventative practices within our clinic setting and community. Our proposed project not only focused on obesity, but also an array of other health indicators, which would provide effective lead-ins for providers to then bring up evidence-based behavior modification approaches and then improve educational efforts surrounding the associated chronic disease management, thus reducing the burden of chronic disease complexities here in the community. So our goal was that integration and care coordination would be able to link physicians to our mobile team and the services we provide, or basically the variety of healthcare providers such as nurses, dietitians, physical therapists, personal trainers, lifestyle health coaches, and other community resources. Next slide.
Our initial vision was to utilize and expand the already existing mobile prevention and screening team to take a multi-level approach in providing health screenings and education efforts at a population health level throughout the community where people live, work, and play. Plans were to use the multidisciplinary mobile team to continue what we were doing before, which was to utilize portable screening equipment and complete basic health assessments. Expand efforts into the homes of elders, collaborate with community resources to improve food systems, create a culinary health education program, expand the number of places where safe and accessible physical activity can occur, and partner with tribal leaders to improve land use design. The combination of all of these efforts are anticipated to provide valuable services that will continue to strengthen the community clinical linkages.
Next. So then COVID-19, so during the pandemic, just a little bit about how our tribe handled it and what happened here. During the pandemic, the Santee Sioux Nation did an incredible job of implementing precautionary steps to keep the community and employees as safe as possible. But with that came trickle-down effects on that affected our work plan. The schools shut down, group gatherings were canceled, security was placed at the borders of the reservation, and non-essential people were temporarily not allowed access to the community. Our health center never actually shut down operations, and staff did not have to work remotely, but all the community outreach efforts were affected in a huge way. Next.
Due to COVID-19, there was, as you can see, there was adjustments were needed. Our subboard work plan was built on the premise of community events and revolved around group, in-person, hands-on interactive learning platforms. So when the pandemic hit, it halted our entire subboard as it impacted every single portion of our work plan and subsequently our evaluation plan as well. Next slide.
So we had to brainstorm very, very quickly on how we would effectively face this challenge and not allow it to become a stumbling block. And that is where there's power and beauty in a multidisciplinary team and having a strong team. There's lots of vision, lots of dedication, lots of power. We had numerous discussions on how our education efforts would have to change drastically. And with the distinctive rise of e-learning, we decided to redesign our program to teach remotely using digital platforms. The team further had to dive into the revision process by deciding which digital platforms would then be the most effective for our specific community. Next.
Even before COVID-19 hit, there was already high growth and adoption in education technology. With the sudden shift away from community classroom settings or venues, we had to figure out how to go with online learning platform to achieve our intended PSE strategies and CCL outcomes. We knew our efforts would have to become virtual and therefore decided to restructure our vision using several different digital options. Next slide.
So the integration of education technology to achieve favorable community clinical linkage outcomes, we believe will become a permanent and integral component of all health education efforts from our mobile team going forward. While community efforts in classroom settings are still very important, the transition to online learning opportunities in the Santee community has enabled our mobile team to reach more people more efficiently and more effectively through like group chats, video meetings, document sharing, and especially at a time when everything was halted, like during the pandemic. And that's just a little overview on some of the changes we had to make and about our grant in general. So now we'll pass it on to the team and let them talk about how they specifically on different portions of our activities had to make adjustments and how they made those adjustments for their pieces. Next slide.
So one of the first things that we came up with was to create and adapt our cooking instruction. Instead of having it face-to-face, we have partnered and we created videos. of healthy meals and healthy snacks that we are going to share on Facebook, and that will be distributed with quizzes via SurveyMonkey for people to give us feedback. And from that, I'm creating a cookbook that will follow along with the curriculum that we've developed. That cookbook will include nutritional information, and it will also include specific information which has our linkage to our commodities program. Several of the meals are focused on how we can use healthy produce from the commodities center or from our own gardens to create this meal. So that will be specified in our cookbook that we're going to distribute. Garden ready produce is also something that I've really pushed in our meals. It's self-sustaining, and it's minimal cost for the community members. So showing how to integrate fresh vegetables in a new nutritional way has been a push. And we also hit the healthy meal planning. So we want to be able to show people how they can decrease the sugars and salts and just create a nutritional meal that decreases obesity, decreases heart disease and diabetes. And these videos were just a couple of those ways that we can do that. We're also going to do a meal prep for several of our wellness center members that will be prepared and then distributed to those individuals. So we're able to make it and bring it to them versus doing it an in-person class. The videos that we also are using, part of it is making sure that we create, we're teaching how to use knives, how to use it correctly, how to appropriately pick good, healthy, fresh produce. Let's face it, not every time we go to the grocery store, we're not always going to find, you don't a pepper off the shelf and say, oh, this one will do. Showing our community how to pick those prime vegetables is also one of the keys that we're going to include. Next.
This is our part with the fitness and activity and health all kind of combines together. And what we looked at really was a 4-tier approach. And the 4 tiers, because I guess 4-leg approach, is because of, we looked at our young kids where we call it our junior program, which is, under 6th grade. And then we have our fitness and athletic program for kids, our adult programs, and then mature adults, which are, I call them mature because I'm getting there, so it's seniors. But actually I'll say is that kind of even before this was happening, Jay and Michael and myself were already doing some things online. We had started to do a weekly Facebook Live course just to cover different topics. We were shooting videos because one of the things we know with getting folks to the wellness center is a lot of times there's a fear factor of going into somewhere unknown or you feel uncomfortable. So if somebody has, and especially for maybe a middle-aged adult or an older person, if they've never gone to a fitness center before, it can be pretty intimidating for them to come, and just started showing some of the programs. So we're using some video and some things in place before the COVID hit. And then when the COVID hit, it just kind of fell into line. So like with the junior program and the fitness athletic program for kids, for the junior program, we've been doing things over the last 2 years with those young kids. We call it our Movement Skills for Life program. And so what we've been doing with those kids is, and it worked out that we could get back together with them, but we came up with like the champion zone where we're giving lessons each week that we can send out to the parents and to the kids, and everything from, teaching movement skills. So there's 12 basic movement skills. And what we know is that if kids whether they want to be athletes or not. If a kid can't hit a ball or skip, they're not going to play pickup volleyball. If they're in the gym and somebody goes, hey, you want to shoot around, if they don't feel comfortable moving. So what we do with that youth program is having more fun in games to teach those movement skills. And then as we move into the fitness and athletic program for the kids, what we kind of use is sports as the hook, because so many kids want to use sports, especially in smaller communities. So we can hook them that way through an education process and start teaching them, nutritional habits, healthy living habits, besides from the athletic standpoint. So we trick them in with the sports, and then we start trying to, and that's kind of at the bottom, the education and empowerment. And what we had started to look at was using, and I'll talk about this here in a little bit too, but online apps, training programs, and that's the same with the adults too. Like I said, we were doing some of the educational things online. What we found out was if they didn't feel comfortable going to the gym, how could we give them the resources to do things, one, either at home, or if they wanted to come to the gym, or, just having the knowledge base for those in the mature. So if you want to go to the next slide, we kind of break it down for each one of the groups. So like our youth program here, a couple of different things we're doing. That's the Champion Zone book that we put out in our junior program. Like each week, what we do, like Jay helps do, we're teaching foundations of leadership. We're doing a Champion Zone. So every chapter, there's 10 different chapters which cover each week. We pick a different topic that we cover with the kids. And like the example is Keith Moore, who grew up in Presho, South Dakota, and he was the head of the Native branch in DC. Now he's back doing FCA. Like he was one of our guys that did one of the videos. So each week we have video presentations. And again, what that does is the sports and the Champion Zone gives up an opportunity, because kids are buying into the Champion Zone and coming to do workouts with us in person. And we can send them into teaching them leadership styles. We can teach them those foundations of leadership. We can teach them the principles of what it takes to become successful outside of sports and activities. So those are some of the things that we're doing with the youth program. And then if we go to the next slide, for our fitness and youth, number of different things what we're doing there. We're actually doing online training with them. So we use an app called Team Builder. And it's a little bit different. We have one for the older adults, but Team Builder is more because you can set it up as a team unit. So every kid literally gets a workout on their phone. So if they have access to an iPhone, if they can get access to a computer. And so what we found out was, when kids couldn't get together at school, we could print those off and post them up. We actually have go Facebook Live, and we have coaches like every day that show from the training facility. If kids can't make it in, they can actually go to Facebook Live and watch the training. So we have a coach on the camera talking about what's going on as the coach is training the kids in person. Plus they can pull up their workout programs. And then with the nutrition stuff that we're doing too, we can pass that nutrition information through this app so that they're able to get that information literally on a daily basis. So Monday through Thursday, they're getting some type of an education. They're also getting some type of fitness and wellness that ties in with it too. So we're not building just from the physical end, but we want to do the physical, mental, and spiritual end with it too. So we're tying in with different training tips and those type of things with the kids in Santee, and then even like Niobrara, and we're reaching out. So if kids can't get into Santee and they're living in different areas, we can reach out through different means of social media, or like I say, even if they have a phone. And then same thing going to the next slide with our adults. We actually do a boot camp class Monday, Wednesday, and Friday morning live at my facility. I live actually up in Yankton, South Dakota, and we do a training a boot camp every Monday, Wednesday, Friday at 5:30, so folks can come there. And then we send those videos down, and I know Michael posts those up on their website, so people at any time can go back and watch one of those. And plus we upload them into YouTube, and those are modified from everybody from a 20-year-old up to, if somebody can't even do a jumping jack, we show how to modify those within the program. And then with the online app, the Train Heroic app is another online phone app that people can pull up. The reason we use the Train Heroic instead of the Team Builder is this is more set up for individuals. So if a senior wants to do, we call it our Right Move program, which shows more like flexibility, maybe using some chairs. They can't get up and do some things. They're able to use that app, because when they pull up the app, they can hit a little button and watch a video that we've either pulled up or we've done on our own. So they can actually watch the video of Jay doing the exercise or Michael doing the exercise, and then we give explanations of what they need to do and what's going on. Then you can see on the side there, like the strength training 101 and the nutrition guide are just PDF informations where we give information on, you know, if I want to be doing strength training, here's some things when you go in, how to set up your own program. Or if you're doing some things at home, you know, what is a set? What is a rep? So that's the education piece that we give them besides the phone app. And then we send, you know, training tips we send out on a weekly basis too through different forms of social media. And then with our seniors, which is the next slide too, it's pretty much the same. So they can have the Train Heroic. And these are just some things like the right moves for like wrist, neck, shoulders, back, hips. We show some different mobility stretching. We talk about lift pain-free, the right moves tie in together. And that's going to be for a more mature population. But same thing with the Train Heroic app. They can pull that app up on their phone, or they can even print off and get information, and it'll tell them exactly what they can do. It can be anything from here's a 2-day-a-week program to just doing stretching, to help if you're having lower back issues, to advanced even where if they want to do some type of a program where going back to the adults, we can set them up and say, hey, you know, like Janet says she wants to run a 5K. There's a program in there that can help her train to get ready to run a 5K. So what we try to do within the program, and if we go next slide, when we talk about the education, is tap into where they're at. Instead of saying, here's our program, you need to change the way you adapt and fit within this program. We're looking at ways to be able to say, how can we adapt the program and get it out to people to modify it to meet their needs, from a senior who can't get out of their home to somebody who maybe comes into the wellness center and wants to just use selectorized equipment, to another person who wants to come in and is maybe training for, like we say, a 5K, a 10K event, and wants to do more performance-based training, to our kids who, like we say, want to teach them how to just move correctly. Because we talk about 2-pattern progression and periodization. If they can move correctly, then the periodization, the program that they put in place is going to last all the way down through the years. So that's kind of, and I think the next slide, that's what we kind of wrap up, is talking about from the educational standpoint of, I know that's just a picture of us when we're doing the Facebook Live stuff. That's a picture of our boot camp, just some of the training tips. That's where Michael and Jay and I were filming, just like on the selectorized equipment. I know one of the things we're looking when all this clears up and folks can start coming back in is actually having like a computer board where when people walk into the fitness center too, they can click on the board. And if they want to know how to use the chest press machine, it will pull up and have a demo with somebody from the wellness center doing the chest press, and actually then give them information too. So as we continue to progress, it's a thing about giving education. The more we can educate, the more we can empower the people to do things if they don't feel comfortable coming to the gym doing it on their own, but give them the empowerment to take care of their own health and well-being, and know that we're a resource for those folks too. So I don't know if there's one more slide or not. I don't have anything in front of me, so I'm winging it. And yeah, this is what we're talking about for the future. You know, one of the things we're looking at is, we've talked about, I don't know how far along we are in it, but taking like the traditional dance and breaking it down, and just show and say, hey, you know, like if we're doing a jump and we're doing a hop, this is how it relates to the traditional dance from that population. I know the wellness center, like when they talked about with community, putting in sidewalks and putting up fitness stations, and then with the Facebook Live program, and that's what Kristen was talking about, to develop even more of those so that kids can look at it if they want to just do snacks, if they want to do a meal, have things ready available for them again, so that we can empower them, so that if they already made those decisions, they have the resources to be able to go to and not go, where do I go to find this out? Because if they get discouraged, I think then they stop, you know, pursuing those things too. So what we want to try to be able to do as the team is to develop those resources, and they know whether they come to the Santee Wellness Center or not, that they have the resources to be able to get that information. Questions? You can go to the next one, I think.
I think that's it for slides, but we'll let Jay jump in here on his portion.
Yeah, so from an educator standpoint, I actually was, be careful how I say this, it was sort of a blessing in disguise that we had to move to this route, because this is a route, the virtual, digital learning, the education process is something I had been wanting to start to do for a while now. And it's just kind of forced our hand to move forward with it, because it is important and it's beneficial to do things in person. But a lot of our communities, a lot of our community members have not really mastered the art of, let's say, like taking ownership of their schedule and making sure they get to an event that maybe they expressed interest in getting to. And there's a variety of reasons for that. There's all kinds of reasons that in our communities that our people can't get around and get places that they want to get to. So when that happens, if we have an event, like a one-time educational event where we present the material, and if they don't make it, they miss out. And so one of the benefits of this is that this information is always available now, and people can always get back to it and come back to it. The next day, a week later, a year, 2 years from now, it's always going to be available, this information, for the community to access. So that's one of the things that has been a blessing about this, that it's kind of forced our hand to move forward with this. There was a lot of learning involved with how to record and how to use lights, how to, what equipment is needed, how to make sure it works, because that's not my specialty. But so that was a challenge, but we just pushed through it and watched a lot of educational videos myself on how to use the equipment and what equipment we should be using. Let's see. So another question that we asked was, okay, well, with these restrictions, how do we get this information into the most amount of hands and, into the minds of the most amount of people possible with what we have? And so obviously in person was out. So that's why we moved on to that social media, YouTube. We're even looking into DVDs, because again, not all the elders are tech savvy, or not everyone has internet access. Most do, but not all do. We can't settle for most. So we're trying to get into the most amount of people as possible. So we're looking into DVDs and distributing those into the community as well, focusing on elders there first, again, to get this information into the hands of as many people as possible. Yeah. But then another thing that this has enabled us to do, like let's say what Christine was saying about her cooking demonstrations, in person you can just start cooking. It's forced us and not be concerned with is everyone up to speed, because people can ask questions. Like with Coach, if we're doing fitness classes in person, people can ask questions. But right now we have to try to anticipate the questions that people might ask and educate to that, like she was saying, with what utensils do you use? How do you use these utensils? How do you clean them safely? Things like that. And Coach, like, what's a rep? What's a set? These are all just questions that we've had to, sometimes we've been in the middle of something recording and then be like, wait a minute, I'm not sure that people are going to know how to do this. So let's stop, or make a note to go back, and then we'll teach to this as well. So, and again, that's something that we can continually add on to as people do give us our, feedback on it. And again, it's just knowledge that we can always share. It'll always be there on these media platforms. As long as we have electricity and the internet, our people can always access this stuff. And so we think this has been a kind of a blessing in disguise with what it's going to enable us to do and enable us to provide for everybody.
And I'm speaking on turn because I'm kind of outside working with the inside. What I've seen too is that, when I'm working with Jen in some different departments and areas, what it forced to do too is really the groups really came together to work together from the different departments. So there's been an overreach and an outreach. It's not just the wellness center working with one person. There's been an outreach with the doctors. And when I go down there, I can kind of see it as an outside person saying, well, we've talked with these people and this person, and even tying in with the community and the school. And that's what I see too. It's really opened doors up for communication and projects coming together through a variety, and not just saying, well, it's just this group that's setting it up. I think when Jay and I and Michael first started doing our stuff, it was kind of like, well, we're doing these videos and Facebook Live things and a couple of these exercise videos. And as this happened, it really just opened some doors up and some availability. And then you think, well, this person could help out. And then even with the different organizations, it's just brought everybody I know it's the COVID separated people, but I think it's opened some opportunities for people to get together. And I think Jen said at the very beginning, or Michael at the very beginning of the slide, to start thinking together as a community, as a group too. And that's what I see from coming into the outside. It's like, wow, we've got a lot of different hands in the pot, but everybody's working together. And I think that's kind of one of the positive that's come out of this whole thing too.
I agree, and I agree with Jay when he says the blessing in disguise, because like Rosie said, collaboration has become key for the community at large. Before you get into getting your stuff done, checking off your activities on your list, and events get siloed. But this has opened so many doors because everybody is, like Rosie said, everybody's separate, but yet how can we come together to reach the most piece of the community? We found that working together, like with CMODS, with the Center for Rural Affairs, with Farmers Market and all that, how collaborative efforts like that can be very powerful. I think that's all we have from our end. If you guys have any questions.
Yeah, thank you all so much. That was a great presentation, and being on our end at Great Plains, it's been amazing to see the changes you guys have made to really make sure that your work plan is accomplished. And you guys have done so much. Every time we meet with them, it seems like they have a new idea every time, and it's great to see what you guys have done. And like Jenny said, if anyone has questions, feel free to unmute yourself at this time, or if you don't have a microphone, you can also type in the chat box, and I can read that out to you. Which I see we do have a question. What is your population size? How many people are participating? And how long have you been doing this?
Population size, how many?
Like population in general, or
Yeah.
scene?
How many people live on the reservation?
I think Christine might know. Is it around 1,000?
I was gonna say 1,000 to 1,500. Yep. Probably 1,000 to 1,500 people on the reservation.
Yeah, I think that would be an accurate estimation.
Okay, so repeat those questions again. What's your population size?
And then how many people are participating?
Well, right now we are in the process of we got our videos recorded. We're still in the process of editing. So the cooking demo videos and surveys haven't gone out officially live yet, or out for people to participate in yet. Our youth program, Rosie, you can jump in here anytime. That has been up and active and has a pretty good participation rate.
Yeah, we probably had, like last year, our numbers were higher. We probably had over 100 kids last year. This year, we're averaging, so we go 4 days a week with the youth program, and this year we're probably getting between 50 and 60 kids, and that's bringing in kids from not only Santee but the surrounding areas too. We've been doing that for 3 years. So last year, because again, some of the restrictions that hurt is we can't bus kids around. So if kids don't have a way to get to the facility, but then besides we're doing them live, kids are getting online for the program too. So I think we had a total with the surrounding area. We had another 150 that were doing that team builder. We're on the team builder app now. Whether they do that every single day, they might not do it every single day, but that's how many had signed up for it too. So I would say somewhere within the neighborhood per month, we're probably hitting between 150 to 200 youth. And that's not just in Santee, that's around in the surrounding areas for like Niobrara, Verdigris, Santee, because we open it up for them. So that's literally everything's completely free for them if they have access to that. So those are our numbers there. I think those would be higher this year. Like I said, if we were able to help with some of those transportation needs, but with the COVID, we just can't. They're kind of on their own to be able to get to activities like that. But that's why we wanted to have that phone app and opportunity for them to still be able to do those things from the youth program.
What was the last? There was a third portion of that question.
Yep, the last one was, how long have you been doing this?
Well, we haven't even gone live with all of it yet. I said the whole, like Jay had mentioned, the whole video editing, video creation, and recording all of these education sessions is very, very new to everyone. So they are recorded and in the processes of editing, and the surveys to coincide with each video. The education survey is hopefully ready for rollout for our little 10-week program, is what we're gonna call it, 10-week summer camp program, hopefully next week. Yeah.
And I'll just say from our point, so this is our third year we've been doing the program for the young kids and the little bit older kids too. And it's just a thing where to be able to start, I know our very first year we did it in Santee, and Michael, you can help me, I think we had 15 that did the very first year. And now, like I said, this last year, we were, on a regular basis with our junior program and upper level program, we were having over 100 kids participate. And this year it backed off. I think those numbers would have been even higher. So I think the key is, for somebody listening, it's like when you start a program, it's the key to just have it and continue to do it and be doing it on a consistent basis. We even had some kids I know with our program before that first year that say, Coach, you show up every day even when we don't. And I'm like, well, yeah, we said we're going to be here. And so I think the consistency is what those kids see. And the same with adults too. If you try a program in the first 2 weeks, there's only 2 or 3 people, I think a lot of times we get discouraged. But if you go, this is something we're going to do on a regular basis, and we're doing it every Wednesday, or we're doing it every, Monday through whatever it might be, however you set your schedule up, if you can do that on a regular basis, that audience starts to grow because you become their source, and they're always going to be there. So I always say, look at, if you're going to do something, do it with longevity in mind, because it just takes some people a while to get in the habit to find you, and then once they find you, to make it their habit, whether it's an online app or it's a cooking program or whatever those things might be. And then the more you do, the more feedback you get. Kind of what Jay was saying, I think the more feedback you get, it's like, okay, now we can tweak this to make it what are people, instead of saying this is what we're giving you, to really listen and say, what do you guys need? And then if we can deliver that to the folks, they buy in and they start spreading the word more so too. So I think that's what I've seen from the program too. So I think once this gets rolling, it's just to have the consistency with the program is huge. I don't know if we answered your question or not.
Yeah, thank you. Does anyone else have any more questions for our presenters? I would like to point out that there is, Jennifer did put an evaluation link in the chat box. If you have time before logging off to take a quick evaluation. Also, this webinar has been recorded, and we will be sending out a follow-up email with the link. So you will have access to the recording and the PowerPoint slides. I do have another question in the chat box. How do people access your programs? By phone, computer?
Yes.
So they can access them any different ways.
All of the above.
Yeah.
There.
They can come in person still and participate. Like Coach had said, they can get on that those different mobile app options where they could do the programs. There will be coming via Facebook, YouTube.
Yeah, you can be on your computer, go to the app, and then print off. If you have a computer but don't have maybe a phone, you can literally go to like Team Builder, print off your workout, and you could, if you wanted to go to the Santee Wellness Center and say, well, here's my workout, I don't have a smartphone, you could print it off on your computer and take it with you to the gym, or if you wanted to print it off and have it there at your home gym or wherever you're at too. So yeah, like there's a number of options, from person to phone to computer. It kind of it comes back again is what does the person need? I think if they reach out and say, how can I do this? there'll be some answers. And then if there's a way that's not, I think that's where we pick on Jay, and then that's where we say, Jay, you got to develop this.
We also have a patient medical library here in the clinic where we have some computers with internet access that anybody from the community can come and use as well. So, if they don't have internet, they don't have computer, don't have phone, they can still get here and, following social distancing guidelines. And it's small enough where we can give people privacy and they can access all those things as well then.
Awesome. Thank you. Any more questions? Okay, well, thank you everyone so much for joining us today, and thank you to our presenters. Thank you so much for taking the time to share your program and tips and your successes. Again, keep a lookout for that follow-up email with the recording link. Otherwise, in the meantime, if you have any questions, you can feel free to reach out to me. And thank you again for joining.
Thanks for having us.
Thank you.
Have a good day.